Can you comment on what insulin does have anything to do with breast cancer? If there are any studies being shown that insulin actually, people with diabetes, type 2 diabetes, diabetic condition have higher inflammation and also breast cancer incidence. Thank you.
The answers are very clear. Diabetes is highly associated with breast cancer as a risk. Diabetes is highly associated with inflammation, which explains part of the vascular pathology that people with diabetes have. An insulin-like hormone called insulin-like growth factor 1 is also heavily linked to breast cancer risk in many studies and is also linked to obesity.
So can you say something about dietarily what people should eat? Is it sugar is bad?
Cliff, you want to do this one?
Thank you.
Cliff, would you like to take this?
No, thanks. So this is a really complicated question, as you probably realize. There are some data that suggest that some of the anti-hyperglycemic oral drugs, most notably metformin for type 2 diabetes, may be associated with some protection against breast cancer through complex mechanisms, one of which would be the insulin-like growth factor. And there actually is a randomized, large, multi-thousand patient trial testing metformin specifically. It gets much trickier when you start to talk about wide collections of food which we eat in varying amounts over varying periods of time, stretching for years. Unfortunately, to test that scientifically and really get a meaningful answer, one has to do a carefully controlled experiment, either in a reliable animal model, but even better than that, translated into patients. And there are real attempts to do that. One of the things that Andy Dannenberg and I are doing right now is giving a fish oil supplement, DHA, as an anti-inflammatory, but don't write it down. Because what we haven't yet done is shown that it works. And it's a very important distinction between just promulgating wishful thinking and actually getting an answer. The only way we can get that answer is to do a randomization and look at endpoints, in our case in the breast, and ideally in the long term. And until we do that, you have to demand that somebody give you real answers, not speculation. So that's one example, but that's a single substance tested for a period of time, in our case 6 months. And in order to answer your sugar question, it would be very, very tricky. I just have to add, though, despite all the hoopla and hype about sugar, you have to recognize that sugar, plain simple glucose, is the most important fuel for your brain. And no matter what you eat, your liver and the rest of your body is going to make sure that there's exactly the right amount of glucose to fuel your brain. And when people deny themselves the glucose, they don't get the big spikes, but through a process called gluconeogenesis, they surely make all the glucose they need and circulate it anyway. So it's not as controllable at that level as you might hope.
So let me just make a
Always corrects me.
brief comment, and that is to empower you. Hyperinsulinemia, as already mentioned, can be associated with the progression and probably the development of breast cancer. That's true. For those who are overweight or obese, it's very common to have a chronic systemic low-grade inflammatory process, which is easily seen under the microscope, actually. So when you hear about interventions such as weight loss or exercise, there is evidence that you can normalize that hyperinsulinemia, perhaps in part by reversing adipose inflammation. So in addition to the fish oil study that Dr. Hudis just mentioned, we're actually actively studying the consequences of weight loss in obese individuals, and we'll be measuring insulin as one of our endpoints.